Thank you. Am I aggressive?
No.
All right, good.
Very aggressive, Brad. You're still alive. I know.
Good. So you're going to work as a team here. Let's get this. All right. Just be aware of your surroundings, your back. Make sure this is not moving around a lot, right? And then we're going to go anesthesia first. So get out, cup your hands, and as a team, go out together, right? So we're going to do the top first.
I'm gonna go. We're there.
And you got the bottom first. We're going to do the top first. So this separates here, right? So this is the top area, so you're grabbing right here. The blue. All right, so just kind of let it go up a little bit, let it out. All right, good. Now watch her. She needs to be doing it at the same time, so we're both going outwards, right? Good, and I'll come in here and you see her. And so I'm just going to show you, when you do this, and then if I was with her, I'd be like, okay, make sure your hand is covered, right?
Okay.
Not like this, not over the other side. But do you see how this is like this?
Right.
You can take that out, or you're coming in like this and going like that, because that's going to go over the arm board.
So we can
So
take
you're
that
going
out.
away from anesthesia, or are you
So the whole idea is to make sure if you're taking it, you're cuffing your hands.
Oh.
So if anesthesia, go ahead and hold it. If anesthesia just goes like this, they're just not going to look. They're just going to go like,
So is this okay?
make sure you're completely in there. I'm going to show you. I'm going to show you. No, you're okay. So when you're, of course, I'm my right hand here, retarded. But if you're going like this and you're kind of making sure that you're, can you scoop it? So you're you're covered under. So you're covered under like that, right? Not your hand sticking out. Oh, this. Oh my God, this is not a good day.
Yeah.
All right, good. All right, so I want to come here. Good, perfect. Patient died. Who cares? Move on.
Sorry, Jim Bob.
Jim Bob Cooter.
Jim Bob.
And do the same thing. You're still cupping your hand when you go down to your feet, okay?
Yes.
Cup out and push all the way out. Keep going, and drop it. All right, not too hard, right? Take the white thing off, throw it at someone. No, throw it at me. Don't take it. No, don't throw it. All right. What do you do, Zoe? This is your field. You're the assist. What do you do when the drape is ready to go? What's the first instinct that you should have? That's the wrong instinct. That's double wrong. We need to get our mayo over the field, get our table set up, and start passing stuff off. So your job, Zoe, is to just first thing I want you to do is get that mayo right over the field. Just put it right over there. What I want you to do is try to finagle over on this side and start passing some stuff off.
Wait, you said it was on the left side, you the left side.
Yeah, you're the surgeon.
Yeah, that's fine. Yeah.
So are we keeping this here or does it
Hold
matter?
on.
Because we always put it up.
I'm going to
That's wrong. I shouldn't have said
Because
that.
MC is wrong. But what if it's not? Is it written in stone? It has to be on this side. What is the key about this? You're right. So just go ahead and grab your table over here, okay? I'm talking to Cheskar, making her nervous. So what is the goal here? Passing stuff off. And what is the guideline for passing
Well,
stuff
it
off?
depends where the
Okay, right.
instrument is.
So if the suction was down here, we're passing it down this way. So let's just say, hypothetically, the suction and Bobby's on this side. So first thing you can do is put some light handles on. Let's do that. I'm making her nervous. Cheskar's going to hit me. But it's like, you should have saw me last time. I can't wait till you get up to the field and make it.
Oh, no, you should have seen him.
All right, good.
Or her time.
I want you guys is just to be able to think outside the box and don't be scared to make mistakes. And nothing's written in stone as long as you're keeping with aseptic technique. Help out. We need to pass off stuff. So I want you to say the Bobby and suction is here. So pass it to me. So if I'm over here, how are you going to get it to me? I'm over here. I know. How are you going to get that suction tip over there? Yes, I'm just let her. You got it. Are you comfortable with your field? I want you to go over there and make sure you're comfortable, set it up, think about life, you're good to go. So just make sure, Zoe, can you pass to the doctor? Is this thing going to kill me? Probably.
Well, yeah.
So what I used to do is when I set my mayo up, this is my operative site, can I reach the doctor, right? Because I want to be on that side, right? And I think you can. So if I'm the suction, I'm the nurse, how are you going to get that to me? You either give it to Zoe, or you can swing it out like a
I was
pendulum.
gonna swing it.
You can, right? Good. All right. So make sure it's tied down and you have enough slack, right?
Where's the thing? Oh,
It's right here. You don't see it?
I pulled the whole thing off. Okay. Aggressive. Be aggressive.
All right. Let's do the Bowie. Same thing.
The suction goes under, right?
Yeah, you can leave it at the top. It's fine. Just going to swing it up here. Good to go. So now the Bowie's going to swing around here. You want to put your holster here? Let's do that. And you're going to throw that Bowie off on the Bowie machine. Throw it to me. Now you're going to get it to me. Swing it. As they say in Forrest Gump, I was dangling. Oh, Jesus. All right, you go. Good. Make sure you have enough slack, right? See, I just grabbed it all. Oh, do you need more? You can't have more. So make sure you have. You can't go back. So hold on. You passed it to me, right? Make sure you have enough slack. You got enough?
Yes.
All right, so I'm plugging in the machine. So make sure you tie down, right? That's key. All right.
Would it go down or would it go
Go down.
down?
Yeah.
But it normally has a thing on it, a cover.
Cover. So that's an insulator. You would just take that off, throw it away. You never
Okay.
use it again, right?
Okay.
Yeah, so that's an insulator, right? So the whole idea, can the doctor reach the operative site? Is it in the way? Do you have another blue towel? I'll show you a trick about this Bowie here. So can I get 2 non-perforated towel clamps? This is just a bonus.
Two non?
2 non. So do you see how stuff's kind of hanging here? Maybe if you have suction that's in the way, especially when you do laparoscopic, it's a big thing, right? So we know that we have a little area where we can put stuff, right? So first of all, I want you, Jessica, to hold this just like this, okay? And first I want to do is open this part up a little bit and put this through inside. Tuck it in like a little baby. Take the first clamp it down to the patient's nipple. No, to the patient. Make sure you don't do the nipple. Right there, right? Good. Now make sure this is all the way in through here. And now clamp this down. Okay. Clamp it down to the patient's, no, just the trick. And can we reach here a little bit? Okay. Okay, so this is out of the way a little bit. You're fine, tucked in. But now we have access to this.
Okay.
And this is all, because you're going to, in laparoscopy, you have a lot of wires. And this just keeps it organized in a little pouch.
I love that.
So in vascular,
You should do that for the-
you can do that. If this was coming through here, that's fine. You can, but in this case, make sure that your steps are not, this can reach, right? Since it's a small operative site. If it was coming from down below, laparoscopic, you might have a camera, a fiber optic wire, a suction irrigator. You got a lot of stuff up here, and sometimes it gets like spaghetti. I used to kind of keep it all organized in a little area in here, and it just kind of come out the end. So chest guard is going to start first, and then we'll do a page. Is that okay?
Sure, yeah.
And then what I want chest guard to do is gown the doctor. I have not seen her do that. And then what we are going to do is put everyone through the ringer. We'll do an inguinal hernia surgery, and I want to come in through that door. Chest guard is going to drape me, not drape me, gown me. So what I want, you're going to be my first assist, so go better. What? So do you want to do this? Okay, what's the question? Okay, so when you guys, just to kind of let you guys know for a refresher, when you're going to gown the doctor, normally your hand's going this way.
Okay.
So and for me, if I have to do the doctor, it needs to be the other way around. So just boom, you're fine. You're sterile, so it doesn't matter where you're touching. Just commit to it. Let it drop, come out, but still cuff your hands because the doctor's going to come in. But also when you drop it, don't let it hit the floor. So it's kind of a motion, right? You're dropping, cuff, and then go into the doctors. Go up to the shoulders and back out. Right? And then maybe the hands, let their fingers exposed because they're prima donnas. They want to come right in, right? And always start with the right hand unless you're about 100% sure they're left-handed.
And he's going to show you something different with the gloves.
Oh, did I? What did I show you?
Because last time, remember I had my
So you're
fingers
gonna,
out and
as soon as you're done with Jessica, I want you to come in here. We're all going to put everyone in the kind of the roles here. Okay, and we'll go through the surgery. Doctor will be here in a minute. Let me get a swig of my monster real quick.
Go get a house tour.
Now I feel bad. I think Chrissy's angry at me. Did I snap at her or something? No. Okay.
No?
I think she got it. Okay. Good morning.
too, Glenn.
Good morning. So always introduce yourself. My name is Brad. I'm a surgical student. Good morning. That's it. Or if you don't want to say student, just introduce yourself. I'm Brad. I'll be your tech today. Good morning.
My name's Justin. I'll be your tech today.
I'm just joking.
Here he goes. No, you're not.
Where's my usual team?
And
Don't worry about it. Ready?
everything.
You're going to have to pretend to time me in, okay? You see your fingers? Okay, because I can just go like this, touch you real quick, right? Right, come right up. Come on, right hand first. Yeah, you're fine. Thank you. I'm just watching you. Have you guys done this before, right? Yeah. Touched you. Touched you. So here's the deal. And I showed. I'm going to show you. We're just. So when I used to get it, boom, flip it out. And do you see this little writing? This needs to be centered. It smells. Facing you.
Okay.
All right, and then go like this.
Oh, okay.
Right. So your fingers are not exposed.
Right.
I used to say thumbs out, but realistically, by the book, you need to have it like that.
Okay.
It's workout.
So writing to me.
You see the writing? Can you find the writing? It needs to be facing me. That lets me know that thumbs are going to go right in, right? So that's a good landmark. Numbers facing me, go out. I'm going to come right in, right?
Numbers facing center. Hands in.
Nice. Okay. Good. Same. Still got to do that. Get your thumbs used to doing it, because I can accidentally come in here like this, right? But I'm going to help you a little bit. Jessica? No, I don't want to second pair. Thank you, though. So get up to your field. I want to come up there. This is your field, right? This is your home. This is your home here. So get up here. You're going to be passing right here. You always pass on where your Mayo side is, not on the opposite side. So I want you, when you down the doctor and into your field, get up here and own it. You're comfortable? Oh, I got this. Yeah, this is your field here. Hiccup, throw up, whatever you want to do. Was that a hiccup? Not a problem. I had a lady that had Tourette's, and it would just constantly do that. And Nicole, God bless her heart, but every time she'd get nervous, she'd go, ah! And she's like, I'm sorry. And yeah, she was here. She was awesome. She's actually at Sebring right now, but and she's controlled of it. She had a little Tourette's.
That's cool.
All right, so time out. We're gonna get serious here now. Your eyeglasses are not down. Why is that? It's bothering you?
I can't see properly.
Okay, we need to get used to that. I know it's hot in here, but eventually that's
Just
no
because we can just have them made into our glasses.
So we're gonna.
So that's,
the little clip-ons.
yeah, so that's what I'm gonna.
All right, let's start figuring that out before externships. Okay.
That's why I put these on, because he doesn't want
Contacts.
to.
I just want you to have muscle memory, good contacts, and some people might even just be wearing that out there. I don't care, or just like this. This is not acceptable because of if you knew the particles flying around in the air. Your eyes will be exposed. If this guy has hepatitis and there's blood plume, you don't see it. And it's just slowly going to your peripheral, into your eyes. You can get contact that way, or contaminated. So good time contaminated. Jim Bob Cooter, we're going to do a inguinal hernia, open case. We have a level 2 fire risk. What type of local do we have? I know you didn't do it. We have general local. What type of local do we have on our field?
General local.
We have general local. So do we have lidocaine? Do we have bupivacaine? Do we have... This is anesthesia. It's different than general. This is a... Okay, so good. So during the timeout, you say what type of local we have, right? And we have lidocaine with epi. It's 2.5 or 0.25% or half percent. Tell them the percentage. Okay, we're ready to go.
Okay.
Does everyone know each other? Yeah. Does anyone have anything to say? All right, good. I agree with that. We're going to go through the motions here. The key for you, Cheskar, is don't get frustrated. All right, do you see where everything's living? It needs to stay there. So if I say coker and you give me a coker, calm and collective, make sure it's clamped once, hold your hand out. All right, and I'm going to come in just like this. Make sure you're coming in, right? And you're feeling it. And if I throw it down, put it back exactly where it lives. Be very anal retentive. Okay, coming your way, Doc. Coker. Boom, he throws it down. All right, you missed that. Throw it down. Yes, ma'am.
When you say clamp once, what do you mean clamp once?
The law.
So when this is open like that, don't give it to him open. Just
Not the
Oh,
whole
just
thing.
one click.
one click. Clamp,
Oh, then
click.
it might be all click. So.
Yeah, well, God forbid it is. That means he's going to have to open up all of them. It's always good to train. I've always been trained to make sure it's once. Because if it's like this, and I give it to you, here you go, Doc. It's awkward, right? So, and he'll go with it, right? And here's another thing. If he gives it back and it's open, click it, put it down, so it's already done. That's a good muscle memory to get into. Click, done, here it goes. You don't have to worry about it
You
anymore.
have your own flow.
Right, own flow here, down, open, click, go. You're just one step ahead, right?
Yep.
Are you familiar with stuff up here? Good to go? And here's the thing, if I ask for something, you repeat it. It's called feedback, right? Hemostat coming your way, doctor. Now, heard, some acknowledgement, not yo, not silence, not,
okay.
doctor, I don't understand you, you mumble. Say, Dr. Hemostat, and he'll say, no, Coker. Coker coming your way, doctor.
Heard.
Even that's just a way of saying I didn't hear, even though it's probably it. No, I want this. Okay, come your way, doc. Don't say, hey, I can't hear you, doctor. You speak up, because they're all going to mumble and be quiet. Hemostat.
Well, like you're really focused. That's why.
Neuros that way. They'll be in a microscope like this. Kerosene, two kerosene, two kerosene, please. I mean, that's how it's going to go, right? So you need to just be like, repeat, 2 kerosene. I said 3 kerosene. Okay, I only said 3. I didn't hear them, but okay, 3 kerosene. That's the only way you're going to verify, by just having some feedback and communication. Okay. 2 laps to the field. We're going to rock and roll, and then you're next up, okay? And then we just kind of go through the motions here. We'll end with my first assist. So when you give this to the doctor, don't give it like a nice folded area. Here you go, doc. Open this up. Just get used to opening it up and just kind of laying it like this so the doctor can grab it, right? Sometimes he wants it to go in and just starts. Then if the doctor's doing this and opening it up, you get paid to do this, right? So it's taking too long. This is going to go this way, right? To this, because that's there for verifying. So just open it up and I'll grab it, right? 2 hemostats. Can I have 2 hemostats, please? Okay. Outstanding. Okay. I'm going to switch with you. Come on my side. Now you.
Will they ever be next to you?
Well, they were well, right?
If they are, we probably should have them right on this side.
I was confused. I didn't want to get yelled at.
What you doing with that?
Don't yell at the doctor, okay? I was originally supposed to go on this side. All right, so we got it. All right, we got it. All right, so can I have a mosquito? You have a mosquito available?
I do not.
That's the answer you're going to have?
No, doctor, but coming your way.
Do you have any on your field back there? So this is your main area, but maybe you don't have it. Do you have it back there? All right, is it clicked once? All right, outstanding. All right, good. So now I'm using that mosquito, and if I ever give it back to you, you can put it up here somewhere, right? But what I want is to just listen to what I have. You hold this, assist. You're just not going to stand there and look pretty. Stand right there. Don't move. All right, Tabeki.
Doctor.
Good. Can I have a tie and a passer?
Coming your way, doctor.
So hold this and let it go when I say with one hand. Can you do it with one hand? Okay. Take it off. Take this off. One hand. Scissors. Throw it down.
Coming your way, doctor.
Scissors. Can I have a straight mayo, please?
Coming your way, doctor.
Straight mayo, please.
Coming your way, doctor.
All right. Is it better to be fast or accurate?
Accurate.
It's not don't get panicky. Don't start throwing stuff around. Come your way, doctor. He can be yelling all he wants, right? Right. Good. Garbage. Hemostat. All right, we have no, can I have a Army Navy?
Maybe coming your way, doctor.
Good. Hold that. Can I have a clamp, please? Hemostat would be fine.
Coming your way, doctor.
Oh,
Oh, it wasn't clamped, doctor. Doctor?
What happened again?
Can I have a medicine bomb?
Matt's coming your way, doctor.
We have a small vessel here. We might have to coagulate. I'm sorry. Can we have I need a tie, a free tie, please. Hold this and this same time, free tie. Don't pull on my vessel. Okay, Tabeki.
Thank you, coming your way.
So make sure we load these up just like this, right? Oh, I don't really need to know story. Thank you. Yep, that's not how you pass. Yep, that's not how you pass. Yep, okay. Good. Yeah, yeah. Can I see the tips, please? Tips. So when I say tips, I want you to go up like that.
Okay.
And just stay there. Tips. So these guys, you come on and you can kind of see here. So the doctor, if you're playing this role and you're helping the doctor out, and he wants to, so when you tie out vessels, you want to clamp then tie, right? So when the doctor wants to have tips, he wants this to go up so he can see the tips.
Oh.
So tips up. So get tipsy. Yeah, you can do that as a.
I was gonna say we can do that.
Yeah, maybe not as a student, but I'm just giving you a.
Well, once we get in.
Yeah, I'm just trying to get you. So when I say that, that's what I'm referring to. Yeah. Also, you need to get used to taking things off with one hand. Take this off. Wait, don't move. Take that off. Good job. Scissors.
Coming your way, doctor.
Good. Nice. That was perfect. I feel good on that one. Good. Good. Got the bleeder. Take that out. Army Richardson, please.
Coming your way, doctor.
Good. Hold that right there. And find the. Can I have the Penrose, please?
Coming your way, doctor.
Can I have the Babcock first?
Coming your way.
Tearing out the ovaries. Very good. Babcock.
So how would you hold that pin room?
Hold that right here. So when you pass this to the doctor, get a debakey or get a hemostat right on the edge here. Clamp it on, right? So hold this just like this. Hold that. Good to go.
Is it
Don't
just
move.
on the ends or?
So here's the deal. Just kind of click right in here like this, because what he's going to do is use this for a stat or pull back on it. So this
Okay, just
and
pinch
so
it a little. Okay.
just pinch it and then just there you go, right? And then I'll have a debakey too right behind that. Good, debakey.
Sure.
Have that up.
I can wait to do something.
So this is when you do a hernia, you want to pull back the spermatic cord. I don't have one. I'm pretending. Right, good. Debakey. So it was good. Or vas deferens, spermatic cord, both of them. Can I have the hemostat back? Pull this up just like this. Very good. So what this is designed for, to be lubricated, right? They'll pull back on it and then they'll clamp up on the dressing, not dressings, the drape words. Good. Take this off. Very good. Pull back. Dig into the hernia. What causes a hernia?
Lifting stuff that's too heavy. Straining your.
Oh, I'm sorry. Okay. So what's the main problem with a hernia? Where's the defect at?
And then and the intestine.
What part of the layer? Well, that's the protrusion part, but what part of the layers is the main problem? What are the layers of the skin? Epidermis, dermis, epidermis, right? So they have the fascia layers, right? Maybe some muscle layers, and there's something called the transversalis fascia. And that's a question. They'll say, what is the main problem? There's a weakness in that transversalis. And that's where your bowel starts to protrude through, and that's where you kind of pop it back in sometimes. Transversalis fascia. Good. All right, we're going to go quick here. So why is this just in here? Okay. Coker,
What's coming your way, doctor?
take that out. Hold this up. 10 blade or 15 blade. Good. Do you have any sutures available? Blade down. Suture, please.
Coming your way, doc.
Hold this up like this.
Okay.
That's not even a needle holder. Do you need someone here who knows what they're doing?
No, I got it.
show her how to do this then. Suture, please. Don't cry. That's not how you load it up. Watch her thing. It's going on the floor. Okay, suture, please. It's accurate, not fast. Who gives a damn about the doctor? You'll get there. Eventually, someone will grab it from you.
You will, for real? In the room?
Yeah, I mean, there's only so much a preceptor can do. Like,
Can you show me?
yeah, okay, that's probably a good one. All right, so this is really, really small. What I advise for all of you guys, don't practice on small ones like this. Let's grab a 2-0 or a 1. This is, what is this, a 4, a 5? Oh my God, this is hard to practice on.
I don't even know why these are in here. These were just in my.
I know, no, I'm not judging here. I'm just saying for you guys to practice under pressure, it's hard. Because what I want you to do, does anyone else have a bigger needle?
I think I can.
Yeah.
Swing that into the.
I think you got a 3.
What do you got over on your table?
Start 3-0.
There, I may have that one. So keep organized. Keep emphasizing that. So here, guys, watch this. And I'll wait for, who's that, Sam over there? No, it's Zoe. Here's Sam. Do you see how it's in the package?
Mm-hmm.
So do you realize the 1/3 of that shaft is right there? So don't take it out of there. If you're not sure where to load up, it's right there. Just go right in and come out.
Okay.
And it's designed to put exactly where it needs to be.
Oh, I didn't know that.
That's so much.
Don't take it out and go.
Yeah.
Now the problem is it's not always going to be in the package.
Yeah.
And so we need to know it's 1/3 on that shaft. That's CST question. But this, at least in the start, I mean, you can get it. It's right there. Right? Click. Take it out. Right. Put that. Don't throw those away. Put it in your sharps or something. So again, when you pass it, what I practice in, and we should all practice together, is drop it. You can pick it up real quick. You have to use your other hand, but stabilize yourself, and then just come in. Right. Use the right hand, choke up on it, grab it with your left, and just come in. Right. This needle needs to be facing your chest. So, suture. Good. Now drop that. All right. Now suture. Now to do this under pressure as a team is going to be helpful when you're out there. So when that does happen, and it will happen, where someone's like suture, you're not like the world falls apart. And I've been there where it's like I'm recharged. Oh no.
I know.
And see, that's I'm not being rude, but that's wrong, right? I'm not trying to be upset with
It's
you.
not funny, my midline.
So that's why.
Hey, you're pointing.
So think about it. Think how's the doctor going to use it? Right? He needs to be like this. He's like, oh, he's going to do something like this. So that's why. Just to give you a good reference, this, instead of loading it up like this, come in here to your chest. This is facing up. Just come right in. All right, just load it. Click. Turn.
Oh, okay.
And now if it's left-handed, obviously you just switch it around. But that's why I would practice. All right, come your way, doc. Grab it. Calm. Come your way, doctor. Gives you a minute. Yeah. I'd rather you be slow and calm than trying to.
Yeah, no.
Just take it. Suture, please.
Can I drop it again? Come on your way down.
Flip it. 1. Down. Okay. So I'm left-handed or right-handed. So if I was left-handed, this would be perfect.
But you're right.
So here's another thing that people get confused on. If I'm right-handed, which way is this facing? So, but think about it. I try to keep it simple, right? As Zoe was kind of alluding to it. If I'm right-handed, it faces left. I know it's weird.
So it's facing.
If I'm right-handed, it's facing right.
Back up.
So, all right. So if I'm right-handed, this, as you're coming in, needs to be facing to the left.
That way, okay.
Right, left, right, left. I know it's weird, but
But it's opposite the hand.
opposite the hand. So if you're this hand, this needs to be facing that way. If you're this hand, it needs to be facing it. It's actually a good analogy there. We get the visual. So it's boom, coming in, right? One more time. How's your hands feeling? Pull that up while you're moving.
Yes.
That's the last thing you would say.
Yes, no.
So it's all right. We need to work on that. So
I don't know why I'm having such a hard time with this suture.
So these things like this, all this, knowing exactly what goes on in Mayo, if you can't get this down, and there's no offense to you, we need to work on this to a point where you're not freaking out. You know exactly it's muscle memory. So eventually we're all just going to get in line. You're going to be in line as a team. We're just going to go like this, back and forth. Drop it like it's hot.
I'm down with it.
Grandma style, right? Boom,
We need that.
We do need
boom,
that.
boom, boom, there. And then you come back and forth, right?
Is
Are
there
you
any
okay
time
with that?
available to come in during the week?
Yeah. I'm here anytime after 12:30 classes typically. If I'm not out of sight, which I'll be going to sites next week, just text me.
Okay.
Or you guys are more than willing to come in here on your own time. This lab is your home. And just let Krista or myself know we want to just work on it. It really is about just going back and forth. And also add scenarios, right? Just say, okay, hurry up. Start testing each other. Or Sam, come on, hurry up. That's not the right way. Coming your way. No. Add these pressure scenarios. You can break. Go get a drink. Who's hot?
So I'm what?
I want you over here.
I want to get this.
Go over here. I want over here. You're gonna play the assist. You can go break.
I'm sweating,
At least get a drink. Don't take your gown off. Because
So just hold this like this.
just be right here. Be with me. So I want you to get organized. Page. By the way, you did fine. I realize it's the passing of the sutures is probably your Achilles heel. Instruments are fine. Being calm under pressure. I can hear under your breath a little bit like I can just hear you're nervous. And I'm just trying to. I hear, but make it till you make it. Coming your way, doctor. Even though you're screaming inside, but doesn't mean you have to go like a bull out of China shop. And if you don't know, guess what? You're a student and a preceptor. If I was a good one, if you're doing that, I'll give you a minute to think about it. And if I see you're struggling, I'll be like this. I'll be like, and then, but the good preceptor will let you go through the fire and think about it a little bit.
I'd rather go.
A bad one would be like, I'm doing everything and just listen to me.
I'd rather.
You know, I don't want to get yelled at either. I didn't care about getting yelled at. I'll be like, you're learning. I'll take the brunt. This doctor's probably going to yell. We're just going to get over it. But you're going to feel just like I will. All right. As long as we're getting, and then if the shit hits the fan, the case is getting a little bit out of rate, I'll be like, hey, just back off for a minute. We'll get through this, and next case we'll get you in. That happens too. Don't ever feel like you got thrown off the side because it was getting hectic for the doctor, and the tech was getting frustrated because he was just taking too much. And it really is about the patient. It's not we're learning, but we're not saying, well, I know he's bleeding, but I want to learn. We're not. It's not Grey's Anatomy here, okay?
I felt good about that.
I think you did fine. You okay?
No, she's nervous.
Am I making you nervous?
You want to keep this suture?
No. Do you have a suture? Give it. You're walking away. Give it to Paige. Here's your Penrose. Put in your water. Here's a hemostat. We're just gonna leave it right here. You're my assist. You got my Bovie. Suction. Suction. This is suction. It's Bovie. All right. We're almost there. What time is it? All right.
Oh, you have.
We got a half hour. And then we'll break down and we'll get on out of here, guys. All right, timeout. This is Mr. Bean. He's having a inguinal hernia. Fire risk. We'll be at 4 o'clock is the time where we're going to be walking out of here. So 15 minutes, we're done here, and we'll break down. And about 4 o'clock, I'm out.
Yep.
Okay.
Yep.
Let's do it. All right. 15 plate.
15.
As I'm burping. Beef jerky.
I think I got a mask on.
I know. I should have. All right, incision. 15. Blade down. Can I have a hemostat, please? Actually, let me get 2 Adson with teeth, please. I'm not hearing anything out of your mouth.
Coming your way, doctor.
Adson with teeth with to the assist, please. Or can I get a rat tooth for the assist, please?
Rat tooth coming your way, doctor.
Let her think it's good. She's not going to be out. You're not going to be out there with her, okay? Unless you're going to be hiding in your little pocket saying, Paige, over there. So what's this? These are all the bakies, okay? Do we have any? Okay. All right.
Your way, doctor.
This is the assist. She's not even here. Okay. So go like this. Just follow me. So pinch it. Right. Good. 15 with blade. 15 blade, please.
Oh, just the top layer?
Just horrors like that. So just whatever I'm doing, just mimic them.
Coming your way, doctor.
Good. Incision. And we're going to make our way down. So you follow me?
Okay.
Incision. Incision. All right, throw your stuff down. All right, we got a little bleeder here. Can I have a mosquito, please?
Coming your way, doctor.
And right behind that is mosquito. Or a clamp. Some clamp. I got a bleeder.
Coming your way, doctor.
All right. Can I make sure it's clicked once? Can I have a, hold that just like that. Can I have a debakey and a tie and a passer, please?
Just like this. Coming your way, doctor. Debakey.
Outstanding.
Tie and passer.
Nice. Tips, please. Can I see the tips, please? So come up just like that. What do I need, Paige? I won't tell her.
That's scissors.
Is that what you cut suture with?
No, straight
Take that off.
scissors. Coming your way, doctor.
Nice. Take that off.
Oh, with one hand.
If you can. Garbage. Do some house cleaning. Look at this mess. Coker. Organized chaos. Coker, please.
Coming your way, doctor.
I got it. It's right here. I got it. It's right here. Got it. Can I get another coker, please? Hold that up.
Doctor.
Clean as you go. Can I have a 15 blade? Hold this just like this up.
Like this.
Mm-hmm.
Coming your way, doctor.
15 blade. Okay. Can I have a blade? Or, I'm sorry, a suture, please? Blade down.
Coming your way, doctor.
Keep organized. Doing good. Hold this up while you're moving.
Coming your way, doctor.
What's wrong? So this tips needs to be facing your chest. So if you're coming in, say that's facing you, you had it like this.
Okay.
So turn, this is facing to the actual chest of the doctor.
Okay.
That makes sense?
Mm-hmm.
So make sure you pass it. That's how he's going to use it. So you pass it to the doctor, you have to pass it to him how he's going to use it.
Okay.
So boom, boom, boom. Drop that and load it up again. Careful, there's a blade here too. You moved again.
Sorry. Stop looking.
Yeah. I found our kryptonite.
That's so weird.
That's wrong. So I'm going to show you one more time and then you're out of here. Like this. Like that. So drop it. Put it to your chest. All right. This is facing to the left. So not like this. Not like that. Needle has to be facing up, right? So this is to your chest and you're coming in, right? Clamp it. And just kind of get to this point. So the needle's facing the doctor's chest. Why are we holding this?
So it doesn't drop.
Yeah, so it doesn't draw. So, right, so it doesn't fall below the field like that, right? So we're holding that, right? So we're passing that to the doctor, and we're just kind of, well, don't drop it yet. And then follow them in and then lay it down. And this will be like right here. Okay, drop it. Don't worry, don't feel upset. This is, everyone that's in there is just, it's difficult. Everyone watching you, you're getting nervous.
When you do it, but when we do
I know. Click it. Is this, you're facing the wrong way. So remember, right hand needs to be facing the opposite way.
right hand faces left.
So get to your chest. I'm sorry, Zoe, but I bumped my big butt right here. All right, good. All right, good. It's good. All right, choke up here with this hand. All right, come to a kind of a vertical. Good. Now kind of turn a little bit so the tips are facing me and come on into my hands. Good. Follow me with that and just drop it. Good, and then I'll come over here since I'm doing this way. Not exactly, right? You don't want to have it too far in. But on the tips, you want to have it kind of like that, right? It's actually the 1/3. 1/3 of that shaft. But something with 3, right? I'm not trying to be exact, but in the book, they'll say 1/3. So, yeah.
1/3. Okay. 1/3.
Good. Outstanding. That was a lot better. That was perfect. What do I need now? Add some with teeth, please.
Coming your way, doctor.
Careful, there's a blade there. So if you're done with that blade, just put it back on your feet, on your back table.
Okay.
What's the odds of that? Scissors? Nice. Load this up one more time. Are you moving?
Nope.
Nice. You got it now. All right. Getting better.
Tell me away, doctor.
Because they'll give handy signals. Right? They just want
They already know.
scissors.
Yeah.
What does this mean?
Use that.
Suture.
Suture.
Suture, scissors, right? Pickups.
Hurt.
Right. What's this now? Oh, Jesus. I'm getting tired too now at this point. And,
What's the meaning? Coming away, doctor.
tell me what to do with you mind. Just checking.
Understood.
He's not gonna say that.
Suture.
You're funny.
All right, let's rock and roll. Get that. We're done with that suture there, the needle. Yeah. So it's important to let them think it through. I know I'm just like you. I want, but it's important. We need to all feel this, right? And I'm just looking. You're doing great, Paige. And eventually, when we get to that final, I mean, I'm so like I want to move stuff around here, but that is driving me nuts back here.
Yeah.
And I guarantee if I see it, the surgeon's going to be like, it's falling apart back there. So it's all about, and I think the problem is the tower roll is too small and everything's falling off the edges. But in a normal case page, it's not going to be that fast where I'm like, like that. But we need to, there's a gap in it, you're still like listening. We're keeping this, we're kind of organizing and making sure it's clean. Because organized chaos through the whole process of a 2-hour case. And if it gets chaotic and we do that final count, will be a lot easier than your back table looks like someone played 52 pickup.
Right. Hurt.
But that comes with experience. But just remember your final exam, I'm going to put you through that ringer of this. You guys are actually ahead. I'm putting you a little bit a part of the, I know you guys are going to do well, trying to deal with pressure. Yeah. This is not as much pressure as I'm going to do later on.
Okay.
And I know we're joking here, but eventually I'm just going to, and there's always someone that just kind of, and it's okay. We're all human, and I want us to feel the pressure here with the hot and whatever, because it's hot here, or anything we need to work on, suture passing. Your basic technique, I don't have any problem with it. And I never did with Chrissy's classes. From here on, everyone that comes here, you guys are great. Right? It's about teamwork. It's about communication, and then we're going to have some fun. I'm going to add you a case as we go along here. And we're going to do carpal tunnel, but it's all basic evaluation. What time is it, guys? So we can get out of here.
So for your ties, like when you're done with them, do we put them here?
So, yeah, let's break down here. You do fine. So garbage, right? Where are you going to put garbage? Is the question. Yeah. You need to find a place where you're going to put it. Is this going to be your garbage? Is that going to be your garbage? Are you going to have an extra bag over here for your garbage? Or are you going to have someone wheel the garbage can over here so you have some area? I personally would try to get something that I'm not using. Let's say hypothetically I would never use this. I would just make this where this is my garbage. Okay. Right? So I would start doing that. Just good housekeeping, right? Or if this is going to be, I like to throw stuff on the bottom. This is just garbage. I would never touch it ever again. But sometimes people frown upon this being moved a lot.
But wouldn't it be a kick bucket? No. Is that just for
kick bucket or just for sponges, right? Yeah. Let's break. So we have 3 setups to start cleaning up on. I don't want to keep anything that we opened, drape-wise, 3/4. But if you have it on your field, it needs to be rewrapped and put into your basin. Does that make sense? On this field, if we open drapes, 3/4, we don't save them. Throw them in the garbage. This field. Blades, throw in the sharps. But you need to make sure you have that stuff back in those little totes, right? If it's on your field,
put it back.
Make sure you wrap your own basin up. Help the people that are with you, right? And I'll help. I will help Zoe out.
You're all right. We got it.
Huh? No, I'm Zoe's team. I don't let you guys down. Even though I'm old and my back hurts, don't get it. So, just kind of give you a thing what I saw. A page, fine. I think suture passing is probably the only thing I noticed. Like, wow, what's going on there? Everything else, pressure, basic technique, going through the motions and setting up a table, you guys are great.
Cool.
And I was so told Chrissy, a lot of you guys coming from Chrissy's classes, she's done a really good job with all of you. And I'm always impressed. And everyone that's out there, preceptors say the same thing. So fall on that as, you know, confidence going out to externships, that your basic skills are above what I normally see. And even when I was a student, you guys know a lot more than I ever known. That's a good thing. That's a good place to be. You don't think it, you don't feel it. You feel like I don't know shit, and you're always going to feel that way. But trust me when I say basic things. We need, yeah, that's all this is. So here's the deal. Also, let me know what you guys want to work on. I already know I want to work on sutures.
Yes.
So if you come to me and say, Brad, I want to do more. I'm not going to work on draping per se, because externship is going to show you tons of draping. Because I'm not going to show you the thought. I can show you a knee drape if you want. But just remember, you're going to do, by the time you're done with externship, it's probably 100 knee cases. So you're going to get more experience of draping out in the field. What I want to work on is basic techniques. Suture passing, passing stuff. Making sure you're passing ties properly, loading it up without a tie on pass or without being under pressure. And then we're going to go over, just get into the point where when I say do a case, I don't have to sit there and say, yeah, it's the downsheet first.
Right.
And then why are you contaminating coming up to the field? We need to just boom, boom, I'll come in here, I'll play the doctor, and we just have some fun with the case. And maybe we can do a case from start to finish where we can talk about the case. We did a little inguinal hernia, but we can talk about a case from start to finish if you get these basics down where it's like, I don't have to worry about them too much. Suture is what I'm worried about. And passing a little bit for some people, just making sure it's closed and passing it normal. And keeping organized through the whole process.
That's hard for me just to keep organized.
Yeah, because you don't know what's next.
Exactly. That's what I'm thinking.
I know.
What's next? No.
So keep it simple, right? So listen, right? Have something in your hand. Over time, you're going to know. Well, that's why I keep telling you to know the anatomy is going to help you anticipate.
Right.
So in the beginning of time, you're probably going to be like, okay, I'm listening, and he needs a hand. You're not really knowing what the next thing is.
Mm-hmm.
You're just listening to what he wants. That's a good way to do it. Eventually, you're going to get into a rhythm. I've done this case many times, and I know the order.
Right.
Like,
I can't wait to get to that point.
yeah, that's a good. But eventually, you're going to be where I know the case. Okay, I know the spermatic cord's coming up soon because I know the anatomy. I know he's down the layers. He's going to be pulling that out. So you're already full 2 steps ahead of him, having that Penrose ready.
Right.
And that goes for any case. All right, I'm on the gallbladder. I know at this point, because in the anatomy, he's going to be ligating the cystic duct and cystic artery. So I'm going to have the clipper ready to go. And that's the difference, right? You can be 3 steps ahead, anticipating. But I would progressively start where just be calm, listen, not sure, repeat.
Okay.
Right? Hemostat. All right. That's why when you set up your Mayo, you need to know where stuff is and don't move it. All right. All right. Think about it. I just put on here for example. All right. That doesn't have to be written in stone.
Okay.
All right. I want my forceps here. Right. Okay. They're always going to be. I want my azimuth here. I want my hemostats here. Have some organization where you know where things are. And be very anal and don't move. If the hemostats started here in the beginning of the case, they should end right here.
Okay.
Not over here. Not over here, because you'll get tunnel vision.
Right.
You know, hemostat, or normally it's here. It might be here, but I'm telling you, you're going to be like. So become very like one way, and since you set stuff up, become made over attentive. Like, don't move stuff. I want it right here. I throw it down, put it right there.
Nice step, brothers.
Don't touch it. I'm telling you, that's the only way you can control the fear and organization is by becoming very controllable where you want stuff.
Right.
Eventually, you're going to know repetitive. All these cases are repetitive. And I guarantee if you do 1 gallbladder, it's going to be a lot different. And I'm sorry, you're going to be more confident after you do about 15.
Right.
Because it doesn't change much.
Yeah.
You're ready to do your 10th gallbladder. All right, I've seen 9 of these. All right, let's go. It's the same thing over and over. And trust me, everyone that's out there right now, they're at week 3 from week 1. They came in there like, oh my God, Brad, I don't know anything. It's the world's spinning. Week 3, they're walking in like they're so cocky, they know everything. That's because they've built a little confidence. It's because they've probably seen 10, 15 of these cases.
Okay.
Don't get cocky where you think you know everything. But that's what happens. You build your confidence that way.
Okay.
What's that?
Besides the suture, what do you think?
No, I did not see anything. The setting up the table is fine. We all need probably a little work on our towel rolls, but that comes with time too. Your Mayo setup, your way you set up your table is fine. Going through your accounts, your respective everything. We talked about the Bobby tip being exposed up at the field. Right, just listen, like I was telling Paige. The problem is you're just really not sure what's next, and everyone wants to memorize a Mayo stand for every case. Unless you're one of those people, go ahead. Most people are not that way. So there are Mayo books that you can have, that you can buy, that give you exactly for each case what goes on a Mayo. And a preceptor is going to tell you what he wants for that doctor on that Mayo. So it's not always written in stone. This doctor only wants this, this, and this, and this. Okay, you need to learn with that. You go to another hospital, it might be different. Yeah. A hernia is there's always going to be a Penrose, there's always going to be a clamp, there's always going to be a hemostat. I was always taught, just make sure you have some ties for any bleeders, make sure you have some clamps on there for that scenario. Hemostat, mosquitoes are just the most common thing, right? If you're using something like the appendix, we'll have some Babcock because that's going to be grabbing onto it. Always the bakies. Adson with teeth are typically used for closures, so you don't have to have those up right away. The bakies are probably the most common thing you're going to use. But for you working on stuff, is make sure you get that suture passing. Everything else, I didn't see that we're going to improve on and extend on this going forward, but I didn't see anything that's sticking out, saying wow, what happened? Just stay. And I'm not trying to say that you have to be keep your comments to a minimum. I know we're joking, and I'm joking a little bit too, but if I say, why are you moving that? Wow, and they go down a long litany of why you're doing it, you say, no problem, doctor, coming your way. Right? Just keep it simple.
I don't think I would do that in the field, though.
Huh?
I don't think I would do that in the field, though.
Wow. You're just going to collapse a little bit.
I
I give
wouldn't collapse.
you an example. If you're up here and you're here, I'd be and you give them the wrong thing, if this is the wrong thing, right? I'd be that's not what I wanted. What are you going to do?
Don't push it.
Don't come in your way, doctor. That's it.
Okay. Oh, I'm sorry, doctor. Hemostat? Yes, hemostat. All right, hemostat coming your way. Pop. Move on. Keep going. Act confidence. Even deep down inside, you're dude, this guy got to get kicked in the head.
The worst doctor, so I'm ready.
There you go. That's it. You know the game now.
I do.
And are every doctor that way? No. I just want you to be used to that.
Call us out in front of patients.
Yeah.
She was so mean, but she helped me. She just trained me.
You needed to just roll with the punches, man. Roll with those punches. And you can come back and talk crap like we all do, but don't do it in that OR, right? Come back here, we can talk together. Hey, I had a doctor, but yeah, I understand. I perfectly understand. I had one too. But we can't do that out there unless it's harassment, and then you let me know. Unless it's verbal stuff, I don't accept any of that. Let me deal with it. Oh, that would be a no-brainer. But here's another thing. Yeah, if it's physical, let that. If someone's punching you, that's a different story. But if they are sexual innuendos or they're anything like that, don't deal with it then. But give me a call as soon as you're done, and let me come down there and deal with that. Okay? Because you're not going to win that battle, but as a student, but I will not accept that either. And you never know. There's a lot of stuff going on in the OR, as you know. You're not immune to the world. You know how people can say things that are crazy. It doesn't mean you have to be a part of it. If it's directed towards you, I don't accept that at all. But you will have things out there say they're joking around. We'll pick our battles. Okay, we can't change the world here.
Baby steps. Thank you.